offer you greetings from sunny North Carolina. And to get started, I'm just hoping that our participants would engage in one of two icebreakers to get started. The first icebreaker I'd like to offer you all is just to stand up and maybe with or without your video to just do your favorite yoga pose, just to get us going and wake us up a little bit. So my favorite yoga pose is the warrior pose. So I'm just gonna step back and do my warrior pose, get my juices flowing, wake me up a little bit. Anyone who wants to join in, like I said, on or off video, you're more than welcome. I'll give everybody just a minute to take a deep breath and embrace all that we're facing. And despite that, we still have beautiful sunlight. Maybe open up a window curtain. I am amongst the allergy sufferers, so I do have my tissues here. And the next icebreaker I'd like to offer for everyone is to just go to the bottom of your screen and just put a small reaction of how you're feeling today. Yes, sunny, hanging in there. Great, great, great. Feeling amazing. Awesome. Okay, I'm glad that everyone was able to hopefully be involved in one of the two icebreakers. So now I'm going to work on sharing my screen. My internet connection had kind of wavered a little bit because I stepped away from the house, but let me see if I can get this back up. So my name is Jessica Newton. I am the clinical director of Stepping Stones, and we are located in Wilson, North Carolina. Lacemond Banks is also here, also from Wilson, North Carolina.
Hello, everybody.
And today we're going to talk about Maslow's hierarchy of needs. And I just want to be sure everyone can see my screen here.
Jessica, we're seeing the mountain.
Lorianne, I'm sorry, I couldn't quite hear you.
Oh, that's fine. I can see your screen saver, I think, but if you're sharing a presentation, it's not showing yet.
Okay.
You may want to unshare and then share again and choose the upper left option.
Okay.
Technology is wonderful and challenging.
Let's see. Unshare.
It's a beautiful screensaver, though.
Well, thank you. All right, we've got me again.
Yes.
And share desktop. Oh, it's sharing desktop. That's why. Okay.
Yeah. Mm-hmm.
And Lorianne, I don't see that button that you were referring.
Okay, it should be one that says showing whatever's on your desktop or whatever's on your screen.
Share screen.
Yeah.
Right.
Or desktop one.
Nope. I'm certainly having technical difficulties.
Okay, happens to everybody.
So let's try this again. I only see share desktop. Share screen is here. Safari. Okay. Let's try that.
There you go. Oh,
Do we have it?
nope. Mine, something flicked, but it took it back.
Alrighty. Share screen. Oh.
There we go. We got it now.
All right. I do appreciate you guys working with me. I apologize for the delay. So we are talking about Maslow's hierarchy of needs. Our goals today are for every participant to gain an understanding of Maslow's hierarchy of needs, to be able to discuss and assess appropriate services, as well as to demonstrate the basic method in psychology, as well as locating resources that may benefit people supported, and identify environmental problems that may pose as barriers. So we have a brief overview of Maslow's hierarchy of needs. And we have 5 levels beginning at the bottom, which is physiological needs. Physiological needs include water, air, food. Safety needs are shelter, clothing, routine, belonging and love, our affection, connection to family and friends. Esteem is self-respect and respect for others. Self-actualization is self-growth and seeing one's potential. So I'd like to go into this brief commercial break. And if you all would laugh and just find the humor in it.
Mike, what's your deal, man?
Come on, man. You've been riding me all day.
Mike, you're playing like Betty White out there.
That's not what your girlfriend said.
Baby!
Whoa.
Eat a Snickers. Better?
That hurt. You're not you when you're hungry. Snickers said.
Воу, уймись. Бать, причем? Да еще головой постучи.
Ты просто псих, когда голодный. Держи, сникерс. Лучше?
Лучше. Ты никогда голоден. Не тормози, сникерсни.
You guys grew up together.
Yeah, since 3rd grade. What are you looking at?
I'm not looking at it.
We're not good enough for you. You look for something else?
No, I don't know.
What are you, big supermodels?
Oh,
Who's us? Supermodels. What do you model, gloves? What are you doing? A girl's totally into me, Brad. Eat a Snickers.
Okay. So that, I apologize, that component of the video was just showing how people are not themselves when they are hungry. And although there is quite a bit of humor in those commercials, we are actually in the midst of historical levels of food insecurity right now. As people, due to COVID-19, are losing their jobs and having to return to sources that they may have been aware of, but have not been able to, had not previously accessed. So here we're actually referring to the lack of essentials to produce some of that actually produce some of the most threatening emotional and behavioral reactions. Again, in those videos, what we've seen most often was some type of anger or frustration. There's a study, many studies, one according to McNeely and Communicating Hunger, infants actually, they cry, they ball their fists, they have face gestures and turning their heads to indicate hunger. Hunger definitely can contribute to negative emotional states when we are supporting others. We definitely want to consider this when there is a lack of access to food. Moving on, safety is the next level of Maslow's hierarchy of needs. The reality of housing insecurity um, is very, very substantial. The United Nations describes homelessness as being a human crisis. If we think about the anxiety associated with simply moving from one location to another, there's lots of planning and preparation needed to assure that that transition goes smoothly. And even throughout that transition, we as normal individuals may have questions about what to do next, and the priorities, the priorities that we make in the overall moving process. And so when we think about that, we have to consider someone who does not have access to housing on a daily basis. Maslow's next level of belonging, next level of needs is belonging and love. And this refers to relationships with support systems. While there are countless methods to address relationships, there's an emphasis here of familial relationships, family interaction, and other friendships that could potentially be affected. So we want to consider here how someone interacts with family, loved ones, friends, and how they maintain those relationships. The next level of Maslow's hierarchy of needs is esteem. And that is the perception, the self-perception of an individual. Finally, Maslow's highest level of need is self-actualization. This is not a level, it's not a level of accomplishment towards some type of mecca, but it's actually just really understanding yourself as an individual. Maslow actually conducted an interview in 1968 where he explains what self-actualization meant to him. He referred to this level as understanding sense of humor, differentiating between offensive natured and funny situations that doesn't hurt anyone. He also referred to self-actualization as social interests, releasing hypocrisy and reactive anger, reducing social and artificial barriers, and self-love as identification. He also describes a love for humanity overall, which is in a lot of cases referred to as agape love. So moving into self-actualization, there's a gentleman by the name of Corey Page, and he conducted a TED Talk, and it was extremely, extremely interesting. During this TED Talk, he stressed that involvement in the community is extremely important. And so he describes a time in his life where he experienced depression, self-harm was huge, and in his daily thoughts, he was really, really in a depressive state. And one night he had this revelation that if no one else loved him, he could love himself. And he began to experience so much satisfaction, not only by loving himself, but also by helping others. He soon realized that if he was involved in activities, then he could be a stronger producer of belonging, esteem, and other characteristics of self-actualization. He continued, he began to volunteer. He referenced running in an 8K, 8K benefit run. And he said that even at that time he was overweight, but he pushed himself because he took such enjoyment in helping others. And so through that time, he began to see that he had a brighter outlook on life, and he expressed those episodes of agape love. And so with moving into self-actualization is really finding joy in what we, really finding joy in activities that kind of bring us a sense of purpose, as well as helping others. Now that we have briefly, very briefly, identified and dismantled Maslow's hierarchy of needs, we're now looking at how do we get this, how do we get the people that we support to this level of healthy living? Well, we have somewhat found a solution to actually execute these theories into everyday practice. And what we have seen firsthand with a focus on mental health and substance abuse, put a strong emphasis on case management. Stepping Stones Community Resources has collaborated with an emphasis on case management to provide a consistent flow of linking and arranging services for each level of Maslow's hierarchy of needs. So here are a few of our resources that we have been able to identify to consistently link people and alleviate the needs identified. So to eliminate the concerns associated with the physiological needs identified in Maslow's hierarchy of needs is the link to food bank programs as well as meal programs. Safety needs are addressed through housing programs, local shelters, and in our area in North Carolina, there's a program called Shelter Plus that also assists not only with temporary housing, but also permanent housing. Belonging and love is through the strengthening of family bonds, through the mental health and substance abuse programs, with a specific goal to address self-awareness and how the relationships may have been damaged because of personal actions. Esteem is a focus on a positive self-image and positive talk in mental health counseling, including specific goals where there's an emphasis on increased self-awareness and a perception of self that can be changed through, for example, engagement of daily positive self-talk. Self-actualization, this truly begins once we look at the belonging and esteem. As Maslow explained, this is an ability to consider others in day-to-day interaction. So the next question is, what do these goals look like in the treatment plan? How do we go from looking at that Maslow's chart and then taking it to an actual treatment plan? And so what we have here are a few examples of goals that would actually be more specific to an individual and actually become a day-to-day emphasis in treatment. And so the first goal that's listed to address the physiological is within the next 30 days, Jane and the case manager will seek ongoing food bank and hot food distribution by reviewing local postings of state food bank database. And so if a case manager or someone working directly with an individual were to go to Feeding America, which is linked below, then they can actually see what food banks are available in their local area. The next goal is specific to safety. This one states that within the next 30 days, Jane and case manager will seek permanent housing assistance by contacting a local DSS worker. Also, there's a link, homelessshelterdirectory.org. And this is also another source where an individual can be linked to temporary and ultimately permanent housing.
And I think what we have found also is that if any of these needs are not met at any given time, whether it's through the teen years, the adult years, what we found is that it could lead to mental health issues, or it could lead to substance abuse use. We have quite a few people that come in, and one of the main things that we try to emphasize, we try to serve at least some kind of lunch or snack, because what we understand is that it's hard for someone to come in for treatment if they are hungry or they're concentrating on the wrong things at that time. So we try to give them the basic needs just to try to get through that part of it so we can get along with treatment.
Our next area on Maslow's hierarchy of needs is belonging and love. And here is, again, just a sample goal. Jane will recognize patterns of family conflict to be discussed in weekly therapy. And this would, of course, illuminate any family issues where someone is becoming more self-aware of their contribution to any family conflict or relation conflict. Next is Esteem. Jane will discuss life events that have led to or reinforced a negative self-image. And with a goal such as this, we'd like to not only discuss those life events, but then replace them with a positive self-talk. And finally, self-actualization. Self-actualization, and again, it does go back to how someone views where someone's self-awareness is, but then in self-actualization activities include this particular example, Jane will engage in volunteer work and or meaningful activity at least 3 hours per week. In the substance abuse program, we do like to encourage individuals to attend self-help meetings. And that way they can be encouraged to see the progress that they've made, as well as be an encouragement to others. And other programs, other types of self-help programs are AA, NA, where an individual can also gain support from individuals that also attend. And we are hoping to, Stepping Stones is hoping to create a program to where an individual would graduate and they would become a one-on-one support to other individuals who are also facing substance abuse and mental health concerns. And the hope here is that they can continue to build in this level of self-actualization. And self-actualization in Maslow's hierarchy of needs tends to be a level that is almost, there's no top, there's no limit. An individual it's almost like infinite. They can continue to grow and be better in everything that they do, continue to build their craft ongoing. So here we have just a simple diagram to show how each level of achievement actually affects the other, and not only how it is executed, but then how the cycle, how it begins an ongoing life cycle, beginning with the physiological. Of course, we have the case management to address these services. Then we have safety, moving on to belonging and esteem, where we have goals for each of those. But the evolution becomes when someone reaches self-actualization and they actually begin to offer these services to others. And they begin to present their experience as a testament and how they were able to overcome their physiological needs. I went to this food bank, and this food bank really, really helped me. And so as this person is sharing their own experiences with someone who is suffering and not having achieved all of the levels of Maslow's hierarchy of needs, they begin to encourage and assist others throughout the process. And next, we're moving into how Maslow's hierarchy of needs relates to business. And so this is how we have attempted to implement Maslow's hierarchy of needs, not only as owners, but as directors, to encourage our staff to feel as a part of our entity. So, as stated, according to Maslow's hierarchy of needs, there's a basic human need for food and shelter. Well, this comes into play with the business because staff need jobs, people need jobs to provide food, shelter, clothing for themselves or their families, which of course motivates them to find a job, and then they become staff or part of our organization.
And if those basic needs are not met, then there will be a greater turnover rate, because everybody, most employees want to feel and to know they have the bare necessities to do their job. It's very hard to go into an establishment and provide a service where you don't have the very basics. So, establishing those, is very key.
And so once physically on the job, of course, we have to provide a safe work environment. And these basic needs include lighting, a clean facility, airflow, heat. If we had an environment that was not suitable for people to work on a daily basis, then of course that would also lead to increased turnover. The next level is safety. And as unfortunately, as history has shown us, if people create a hostile work environment or an environment where employees or staff are not feeling safe and comfortable, where they feel like they would be not only criticized, maybe physically damaged or physically hurt, this is not an environment that someone will want to stay in. So again, it's very, very important to provide an atmosphere or environment where people can feel free to report any concerns that they have, as well as feel free to present any ideas or free thinking. Next is belonging. And what we found here is that people at work, they feel that it's, again, safe to present ideas, as well as feeling part of the agency. And so when we have been able to successfully implement individuals' ideas in the workplace, it's definitely created a much stronger sense of belonging, and where people are able to see that their opinions are valued, then it also produces that feeling of belonging.
It definitely enhances communication within within the agency, staff and teamwork. It allows us to gather more ideas from those that may not have, who didn't feel as free to communicate prior. And once they see that we are open and we are accepting of the ideals and things that others have, then it definitely encourages them to feel that they feel a sense of belonging and want to participate as well.
Next, we have Esteem. And this is creating an environment where individuals can be empowered, can be praised and recognized for accomplishments. It also contributes to employee morale. And employee morale is huge in the overall esteem of the business itself. In our experience, employees that were valued and important to the business tend to go above and beyond, definitely producing positive results. We have personally experienced where the change in morale could definitely create a huge climate change throughout the business. We've definitely encouraged many individuals that have come in as interns to not only work to pursue their degrees, but also encourage them to pursue other certifications, as well as anything that they feel would benefit them professionally, because we do understand that any growth for an individual is growth for the business overall.
And with that being said, I think that as owners, what tends to happen is that when we see good in an idea or a person, instead of passing it along to one of our managers to say good job, when we take the time to actually tell that person ourselves, then it tends to go a little bit further, just because they know that their work is not only being noticed by someone who supervised them, but it's also being noticed by, the owners of an establishment. And, to hear kind words from that higher, that level, it definitely can move mountains at times. So we definitely encourage anyone who has a business or thinking about going into business to take that into consideration, not being above acknowledging good work, even when that person is not directly supervised by you.
Finally, we have self-actualization. And this is, again, the highest level on Maslow's hierarchy. And it's the need for fulfillment, living up to one's potential and using one's abilities to the utmost. In business, giving employees the opportunity to think big and be creative, to have a vision for the future and provide direct input in senior leadership allows for employees to work up to their full potential. Providing this opportunity allows employees, allows them to break through glass ceilings, and this will not only aid the employee, but also allows the company to enter or to be open to groundbreaking ideas. And again, this definitely goes back to boosting one's esteem as well as a sense of belonging. And so when we step back to take a look at Maslow's hierarchy overall, once those basic needs are met, the physiological and the safety, then it becomes a constant growth of the level of self-actualization through esteem and through belonging. It's almost like a constant work to build individuals up.
And lastly, in looking at a lot of the Fortune 500 companies, what we have found is that in some retrospect, they all go back to trying to solve the need. In business itself, you're trying to provide a need for whatever your product or your services are. And as it relates to your employees, you want to do that as well. You want to make sure that those basic needs are met to give them the tools to provide the service that you're being paid to do.
So we have actually observed a number of companies that that actually implement Maslow's hierarchy into their business itself. A few of those are Wegmans, which is a grocery store, Google, which of course everyone knows, Google search engine. Another company is Thomas Keller's French Laundry in Napa Valley, Cornell's Food Industry, and that's just to name a few. Maslow's hierarchy definitely tends to be multifaceted. It's not just limited to the direct care of individual or direct support of an individual, but it actually goes into many different ways. So here are a list of some of the sources that were used in creating this presentation. And we would like to just offer you one more thing.
Organizations can begin to climb the hierarchy of needs by following a few basic steps. That's orientation, assessment, action, and measurement. Those are 4 steps that can help your agency climb the hierarchy needs.
So at this time, what we like to do is to allow for individuals to ask any questions. And let's see.
And Jessica, I'll jump in. I put one in the chat, but this is Lori Ann. I'm curious because I know you had a really strong business model before COVID, but I'm wondering, in relation to Maslow's hierarchy of needs, how has the COVID-19 pandemic changed or not changed your model? And, how, like, for example, one thing that came to mind for me was, how do you create safety for your employees in this time? Just as an example.
Well, safety for our employees at this time has definitely included different procedures that we've done throughout the office. One thing that we have done, we've set an hourly wipe down throughout each of our buildings. We have attempted to provide them with personal protective equipment such as gloves and masks when available. And we have attempted to create parameters in which individuals could work from home, and offered limited hours and limited interaction with individuals in the public.
Thank you.
And I will say that with the emergence of COVID-19, I have definitely seen an increase in the need for the lack of fulfillment for for physiological needs, which is the presence of food. Individuals who are experiencing the lack of employment, which in the terms of Maslow's hierarchy and goes to job placement. People, they get jobs to provide food and shelter, but without jobs, then their family is suffering the physiological lack and with the lack of food or the lack of access to food. And so we have seen more of those being utilized, more food banks being visited. And I think that that's very evident across the country, just on the news. I think every day we're seeing that more and more individuals are needing to access sources like that.
Either Jessica or Maria, could one of you comment on, I know, the form that you use for screening employees that have been out? I think every employee was screened when, as soon as from the health department, was the health department form. Would you talk about that screening form
Yes, sir. That screening form did ask about travel, if anyone had traveled outside of a particular area, if they were experiencing symptoms, associated flu-like symptoms, temperature, nauseated, feeling nauseous, and coughing, sneezing. We did also screen if individuals had been in direct contact with anyone that had tested positive for COVID-19. And if it was a case where someone did, then we offered resources for them to either go to the health department, to the hospital, and in some cases even our local primary care office as well. And so I thank you for pointing that out, Dr. Harris, because that was another safety measure that we did put in place for our staff. And going back to that, the lack of interaction with individuals who had not received testing, we have tried to implement some of the telecommunication, to continue our support for our individuals, but also to provide that safety and protection for our staff, and so that they know that they're not being put to that their presence is valued.
And I'm not trying to monopolize here, but I love your program, Jessica. It's just an amazing, integrative, whole community focused. I'm a huge fan of yours. And so I'm just wondering, you were already providing like just this amazing level of community outreach and integrative healthcare. How are you handling the additional stress? I mean, now we have 400,000 people out of work. We have people who 3 weeks ago had no idea they'd be out of work today. And, I'm thinking that's going to, we're going to deal with an increase in substance abuse, mental health crises. I mean, just how are you as an agency who's on the front line handling this?
Truly being in this position, we've just tried to, number one, be extremely flexible. First thing is to, just step back and look at truly what things are in our control and what things are not. With Lacemond and I being, the CEOs and director of everything, we had been able to just create different plans. The first thing was spending late nights at Walmart stocking up on disinfectant and protective equipment and putting in large orders. The second step was to devise a plan to, again, just try and keep our physical facility as clean and as infection-free as possible. And the next thing was to look at, just potential options for the people who support us every day. How can we still provide the service, but also still provide security for employment? Because we understand that the people who support us, our staff, are the people who are needed to continue to support the community. So when we just take that step back and look at, our options, how can we protect those people that support us? And how can we protect the people who we support? Just step by step, taking a step back. Okay, let's limit the face-to-face, let's try the social distancing, but still, implement the telecommunications. We're looking at reports that are being released every day and the changes in the services that are offered, but also offering the the brief training to our staff and how we need to adjust to these ever-changing times. One thing that we had to be, and I can't stress this enough, is truly being flexible but prioritizing the people that we support.
And another thing we had to do as well was try to find solutions within the demographics of those that we serve in rural communities, low income, with today's technology. To have FaceTime or to have Zoom, but you have a prepaid phone, which you only have a certain amount of minutes to just do a phone-to-phone conversation with somebody, how to integrate that population and trying to get them up to speed not knowing what's going to happen in the future, and what part of telecommunication we'll be using in 60 days, and trying to equip them with those things that will be needed.
So, Lorian, I hope that answered your question. I know it was a little late.
I just posted in the chat, about how, and you and I've had these conversations, how all the things that you and Lance are talking about are things that you don't have preparation for in your graduate program. The day-to-day operations of an agency, how to connect in the community, how to follow all the rules and regulations and keep up with them. I mean, it's just really, I really appreciate you bringing this, because I think it's important for students especially to hear that there's this business side, there's this, wellness of the staff, and even of your own self-care as leaders of how are you taking care of yourself in this process.
It's very, very important. And I agree. That's, information that's not always covered in a program, but it's very, very important to look at, because you do have to be flexible, and you do have to look from so many aspects, because even if I was just an independent practitioner and I just had a private caseload, I would still have to make preparations. How do I avoid taking this home to my family? Because I need to be vigilant of any possibilities that could happen, whether it be in person there, but then also how do I protect the people that I support?
Yeah, I know last week, Jessica and I had a conversation. We were there at the office, and we were, it was on a Tuesday, and we were talking about how people just still walk in. And you would expect, with everything going on, that people weren't walking in. And she was talking about trends and patterns at the agency, and how still on that particular Tuesday that they have a number of walk-ins on Tuesday. And, if they weren't open, where would they go, or where would people go? And the lobby was full. And she was talking about staffing, and how she was going to adjust her patterns and scheduling, and what she had to do as far as people adjusting and getting people to call in or telehealth, how she was going to adjust that, because people weren't coming in on Monday, and she was going to have to increase, have some people there on Tuesday, and just adjusting her schedule on certain days, and even thinking about patterns. And you would think nobody would come, but they were there. And it was last couple of Tuesdays, it's been very full, and adjusting those patterns for that day.
Yes, definitely. It's been, I can't say it enough, being flexible and being, willing to adjust, because every single day, we've gotten new announcements and new changes. And so having to, follow those regulations, we have to be ever flexible, and just maintaining or staying true to our priorities, which is, utmost before anything is safety of the people that we support, as well as our staff. And so really just, making that, that list of priority, and however we can move or adjust, within reason. And so I am thankful to the individuals that did sit up late nights to make adjustments to service definitions and make provisions, to be able to create more flexibility in the provision of services. And definitely thankful to companies like Zoom and, conference calls, that's just made it possible for us to still be a support system, but still be safe, be safe. Does anyone have any other questions about flexibilities or Maslow and how to adjust in such a critical time? I see that someone listed, this brings up the idea of radicalized implementation for coming in and living out the process of cultures. So that's definitely a great point. And so I think this individual is, referring to referring to the interaction. Let's see, Melissa, yes, you can definitely get a copy of this presentation, and it'll be sent to, I believe it's Miss Danita, and Miss Danita will share it.
Yes.
I agree, has been an eye-opening experience on many levels, definitely, definitely. Okay, well, if no one has any other questions, Dr. Lorianne, Dr. Harris.
Yeah, I would say that I would just encourage everybody to take advantage of our keynote speaker, which is next. So, you know, we're very excited to have our keynote here with us this time. So starting at 4 Eastern and 3 Central, we'll have Inside the Locker Room by Ron Brewer. He is the Director of Player Engagement at the Cleveland Browns, and we're super excited to have him and have him talk about the work that he's been doing in destigmatizing mental health within the NFL and other sports arenas. So very excited for that. So please join us. And thank you all for your participation. And Jessica, guys, you guys keep up this amazing frontline work you're doing.
Thank you. Thank you guys so much. Thank you for the opportunity. Stay healthy.
Thank you. You too.